Hello and welcome to Mirror Talk. We have moments where we just have to pause. Just pause and take a break and reflect on life. Remember, you are strong, you are enough, you are capable, you are blessed, and you are loved. Your moment of greatness starts now. In this episode, we'll be learning from a student research assistant who is currently completing a master's degree in public health. Thank you for joining me today, Opeyemi Ayanwale. How are you doing?
I'm doing great. Thank you so much, Toby.
That's amazing.
Glad to be here.
I'm glad you accepted the invite to join me today. So, can you tell me about your journey so far in the health sector?
Wow. Well, it's been amazing here, especially when thinking about where I was coming from. I mean, coming from a developing country that we have quite a lot of issue with our healthcare system, and so coming to a developed country, having quite a lot of opportunity, having to see how healthcare can be improved, how our health can also be improved, and what quota we have to contribute. I mean, it's really been an amazing journey. We've blamed quite a lot on our healthcare system from where I was coming from, but healthcare system has actually moved from this hospital centralized approach to an individual approach. Like everybody has a kind of control over their own health right now, and this is really fantastic. So it's been an amazing journey, learning that's okay in my health, how I want to manage my health. My health management is actually falls within my own capacity. So it's really, really amazing journey so far.
And that's one of the reasons why I want to talk to you and learn from you today, because I've been hearing about this thing, healthy lifestyle. So what does that mean? What does it mean to have or to live an healthy life, or what does it mean? What's the meaning of a healthy lifestyle?
Okay, so healthy lifestyle, or we can say healthy living as well. So it means maintaining a kind of a healthy lifestyle, and in such a way that you introduce habits that improve your health. So we have naturally we have different kind of lifestyle. That's like how we live, how we behave, the choices that we make. This is like all the stuff that actually make up our life, like our lifestyle. So lifestyles are kind of like social prints of how we live. They guide our habits, frame our behavior, our consumption choices, shape our identity. So the choice we make on food, mobility, communication, interactions, how we live, everything we do, every of our actions, what we pursue, wellness, happiness, everything, that's lifestyle. So when we now talk about a healthy lifestyle, we're talking about a lifestyle that is healthy enough, that is kind of has a profound impact on your quality of life. So that's just what healthy lifestyle is all about. So
are there like do's and don'ts for someone who wants to live a healthy lifestyle? Or healthy life, sorry.
Yes, of course. And there's another thing that we also have to have in mind. Like, good health is not just absence of disease or illness. It's a state of complete physical, mental, and social well-being. So it's not just about our physical health, it's also about our mental and social well-being as well. And because you are not sick, because you don't have one illness or disease, does not mean that so you have a perfect health. You understand what I'm saying? So that's why our lifestyle, because it's something that we can actually control individually, we can control our lifestyle, and it's one of the most important factors influencing our health now. So what we do, it's actually very important. It has a kind of impact on our quality of life. So this means eating a balanced diet, getting regular exercise, avoiding tobacco and drug, getting plenty of rest. We need to sleep. We can't just be working and without sleeping. Our body needs to rest as well. So it's so many that we have a lot to actually do. So medically, fitness, sleep, nutrition, social wellness. All of these actually come together to actually build up like a good health. So it should be part of our lifestyle, and that is what we should actually like pay much attention to.
Yes, you made mention of now, like medically, like in that sense, does it mean that I should always go for checkup, or I can say I'll eat balanced diet, I will sleep well, and I don't have to visit the doctor?
Okay, yeah, you're very correct. Like, yes, what I mean by medically, like, we have to, I mean, we have to have this habit, like, go for medical checkup. Yes, I mean, coming from where I was coming from, I know it's more like, okay, I'm not sick. I don't have any issue. Why should I go for a checkup, or why should I just go, and why should I go and clean my teeth? Why should I go and wash my teeth? You understand what I'm saying? So it is
Yes.
very important. There are annual checkup that we are supposed to be going for, and at a particular age, I mean, for different gender, be it female or male, there are some essential annual checkup that we are supposed to go for. So even if there is a potential disease, or maybe not communicable illness that is actually springing up or something, early detection of it can actually help us, you understand, to
Yes.
reduce the effects on our health. So it's important for us to do all those. We actually overlook it because we think, okay, it's just nothing serious because I'm not sick, I'm okay, I'm doing great. So, but it's important for us. So, the little things that we think are not very necessary, yes, it's really, really important. Up to the extent of your teeth, like you really have to like check your gums, check your teeth, go for washing, go for medical checkup. You understand, different kind of screening. Yes,
Mm.
from, and there are quite a lot, maybe from one screening or the other you might be recommended to take a particular vaccine or something. This is all like preventive measures that can actually help our lifestyle, and that can actually help us to have to live a healthy lifestyle. So these are really important. So medically, we really have to be um, we really have to like take that very serious as well. Yeah.
Yeah. Wow. So, living medically, let's go into like some physical health. How does living a healthy life affect my physical health? Uh,
Wow.
Are they connected?
Yes, yes, they are very, very connected. Yes, they are very connected. You see, there's quite a lot of us that have this sedimentary lifestyle. I mean, we sit in front of our laptops and or our computer for hours. We sit and watch movie for hours. We are just there. We are not moving, and this is
Mm.
really, really bad for our health. This is bad because there's actually like we have to have like at least 30 minutes of physical activity a day. So we
30
we really
minutes.
need to be like we really need to be on our feet. We need to be active because it actually helps our immune and body system to be in shape.
Mm.
We can't just sleep and sit without doing anything. So it's really important for us to exercise to keep our body index in a healthy range. That's another thing. You could just sit and be eating and be eating and adding more fat, carbohydrates, not burning anything at all, which is not good. Like this, our body, there's a particular range of fat and carbohydrate that has to stay in our body, and there is a particular amount of it that needs to actually be burned. You understand? So
Mm.
regular exercise help our body mass index to be in a healthy range, and this
Yeah.
actually decrease the chances of one suffering from heart disease, diabetes, or even depression. Yes. So exercise is kind of like a very key component in management of our health. So it helps us a lot. It helps in managing high blood pressure. It helps in managing your joint and muscle disease, and even relieving
Mm.
stress. Yes. When you're stressed, check your physical activities level as well. Yes, so
Yeah.
it's more like it keeps both the body and the mind strong when you're physically active. So it's really good for us to set an activities goal like, okay, I need to be physically active for so
Mm.
and so hour today or tomorrow or next tomorrow, and that's how we are keeping up with our health. Yes.
Yes. You made mention of this body mass index, BMI.
Yes.
How can I know the best body mass index for myself? Is there like a fixed, or how I can calculate it, or a fixed number for me?
Yes, there's actually BMI by per age. Yes.
Per age?
Yes, we have BMI per age. Yeah. So we have like there's actually like I think there's WHO actually have a recommended body weight based on BMI values for adults. So it's used for both men and women. So I think for normal category you have to have between 18.5 to 25. For you to know that you are overweight, by the time you start crossing 25 to 30, you're already overweight. Then when you start crossing 30 to 35, that's obese class 1. And then by the time you start crossing to 35 to 40, you're obese class 2. So, yeah. So there are like, there are some, like, we can calculate it based on your age as well. Yes.
And for example, if someone is in like obese class 2, what would you recommend that person to do to get to like an healthy stage or range?
It's a long journey. Yeah, that's just, it's a long journey because, you know, being obese is not something that just started or that just happened like within a short period of time. It's something that happened over and over and over. So to also get back to having a normal body mass index, then there's quite a lot of work to do, but it's a step by step also, because I wouldn't lie to you, it's not very easy. So you have to, you have to go on diet, you have to watch what you eat, you have to change your diet completely. Probably what you've been eating before have influenced your body mass in there. So now we have to look for a kind of nutrition plan for you that is going to help you fall in line or within the normal BMI range. So it has to do with you have to be physically active. That's just it's very important. So you have to exercise a lot, and then you have to eat a lot of fruits, a lot of vegetables. So just know that your nutrition is really going to change. Yeah, there are some things that are going to be cut off partially. There are some things that are going to be cut off like totally, and there are some things that are going to be introduced so you could just get your normal body in this.
Okay. So to know all those things that will be cut off or added, one has to like consult the doctor to know all the stuff.
Yes. Yes.
Wow. So so far on this journey of this podcast, I've been hearing a lot about mental health. Now I want to know: are there ways a healthy lifestyle or a healthy life? Are there ways that can improve my my mental health? Are there ways a healthy life can improve or could improve my mental health?
Yes, there are ways, of course, that you could actually, like I said, feeling good about yourself and taking care of your health is kind of very important for your self-esteem and self-image. So it is also very important to have social awareness. Like, it's not only important for your mental health, but it's also like having a meaningful relationship and support system. They are kind of integral parts of physical health as well. So they are kind of interrelated to each other. So your physical health and your mental health goes along together. So you doing an exercise, like I said the other time, you're actually improving your body and also your mind. And then when you have meaningful relationship and support system, I'm talking about having friends around you, family, loved ones. They also help improve your mental state. Also, sleep. It's very important for our mental state. We kind of sometimes we kind of do quite a lot, work, and we just forget that, yes, so this body, we really need to actually rest at some points. So sleep actually serves as the main support for of immune system. Research will say we need 8 hours of sleep at least. So
At least 8 hours of
inadequate
sleep.
sleep can actually also cause quite a lot of danger to your mental state or your mental health as well. And whatever affects your mental health or your mental state definitely is bound to affect your physical health state. Because just think of it, when you don't have a proper sleep and you start having headache. When you start having headache, can you do anything? You probably might not be able to actually concentrate at work or even read or something. So they are all connected to each other. So whatever we do to actually improve our physical state or physical health or physical state of mind also have a kind of effect on our mental health as well. Yeah.
Talking about sleep, you said at least 8 hours of sleep, right?
Yes.
At least. Okay. Or is there like is there like anything like, is there something like having an LD or having a LD sleep pattern?
Of course, you can also have an healthy sleep pattern. Like for example, for me, some days I really sleep very late, and some days I sleep very early. I mean, everything is about balance. You have to look for a way to balance it. There are times that we can't do anything about it. We have quite a lot to do. We have deadline to meet up with. We need to work extra hours at night to kind of meet up with our deadline. But then it doesn't have to be every day. It doesn't have to be every day. We need to check our sleep patterns. Like, okay, I am supposed to have an 8 hours. How many hours did I sleep on Monday? Or 5 hours. On Tuesday, also 5 hours. On Wednesday, 5 hours. Oh, okay, then Thursday, I need to sleep for like at least 10 hours. Okay, Friday, I need to sleep for 10 hours. So that it's going to compensate for those days that you actually did not sleep very well.
Yeah.
So we really need to look for a balance, and that's how we can actually improve our health. We can't just be ignoring the fact that, okay, I'm just going to be fine. I can sleep for 5 hours and nothing is going to be. Nothing might be wrong with you. You can sleep by 3 a.m. and you're up by 6 a.m. and you think, oh, I'm fine, I'm okay. But you really need to start thinking about the after effect of it, because some of the funniest thing is all this lifestyle, all this living or our choices that we make now. Some of them we don't even see the effect of it right now, but maybe some years later, when it has already built up and it has started affecting quite a lot in our body system, and before you know it, it's reduced the quality of life. If you have been active, do the necessary, eat fruit and vegetable, you could have maybe like 2 years or 3 years extra, even to the normal quality of life. So it's really, really kind of like essential for us to actually also look into all these little details. Yes, sleep is very important. It has quite a lot of effects on the duration of one's life or quality of life. So our personal lifestyle, everything that we do, like I said, has an effect on our quality of life.
Lack of adequate sleep could lead to, for example, depression or anxiety or stuff like that.
Yes, definitely. Yes, it could lead to, because you've been working, your brain have been working, it doesn't have the time to actually rest, and then just rest and then come back again and then start working all over again. It's just like even if you have what's it called, a tool or a machine that you are using for something, if you use it over, okay, let me use an example like a blender. If you're blending maybe your smoothie or fruit or something, if you keep blending and blending and blending, there are some blenders that they will stop automatically on their own. Do you know that? Yeah, they will stop automatically on their own. So you can as well liken that to an human brain, of course. So when you keep stressing and stressing and stressing, it gets to a point, and that's why you see some people, they have brain cancer, they have brain tumor. But the person was healthy. And you'll be like, but there's nothing like brain tumor in my family history or in my health history. Where did the person get it from? You understand? It is because of the kind of lifestyle this person has been doing. Ask the person, how have you been living your life? have you been sleeping when you're supposed to sleep? Have you been resting? So it's really, really important. So if you keep stressing, this brain, you stress, you read, you study, you do some calculation, you do some work, you have some tasks to work over, everything. When you're supposed to sleep, sleep. Yes. Don't just say, "Oh, I can. I'm okay. I'm all right. I'm a late sleeper and an early bed waker. Nothing is happening." Or when I wake up in the morning, okay, or I'm going to take a coffee or something. Even coffee is not good. So much of coffee is not good. You have to balance everything. You have to regulate everything. So that's just it. So if you keep doing that, you're harming your mental state, and trust me, it might not have an effect right now. You might not see any effect right now, but you might be lucky. Nothing might happen to you. You might actually be lucky. Nothing might happen to you. That's the funniest thing. But just don't, I just feel if we have the chance and opportunity to actually take care of our mental state and our physical health, why can't we just do that so we can have a prolonged life, like a lifestyle that is really, really enjoyable, and your old age, you're just like very happy, very healthy and agile, not having to deal with old age disease or anything that just come as a result of how you spent your active age. Yeah, there are age that we are active, and when we start getting to like 45, 50, 60, we are less active. So how, but now that we're very active, we really need to take care of how we live our life, like the choices that we make. Yeah.
So earlier you made mention of eating balanced diet, sleeping well, and other things. So most of these balanced diets, they could be very expensive, as in, I don't know. So are they like cost effective or affordable things I could do to improve my health? Like, what can I eat that won't cost me too much? What can I do that won't cost me too much? And in the same way, improve my health.
Okay, so yeah, we can't dispute that. Yes, it could be very expensive, but at the same time, we have to think about the outcome of it as well. Yes. When you think about, okay, me eating healthy is actually beneficiary to me, you understand, then you probably will want to do all that you can to actually eat healthy. And I don't know, I think where we are currently, I think it's something that is actually achievable and possible to actually eat healthy, and we don't have to spend all our saving on it. Yes. Then there's also something like our plate does not really have to be full, like over full. We need to watch the quantity and then the calories in each of this food. So there are food that are quite cheap, and then carrots, tomatoes, broccoli, apple, vegetables, salad. They are really, really nice. Yeah, and they are the kind of food that are actually affordable. When you think about all this junk food, sometimes some of them are quite expensive than all this fruit and vegetable. But the reason why we go for those junk foods is actually because they are fast food. We don't have to cook them. We don't have to do anything to them. It's been prepared. I just pick up this burger. I just start eating. That's the idea. But for vegetables, I am going to have to probably I have to wash it. Probably I have to steam it. Probably I have to cook it a little bit, probably I have to dice it. Probably I have to cut it. And we are so, like, I don't have time to do that. I just need something that is already prepared. Let me just eat it. And when you look at it, those fast food, they are quite expensive actually, but because it saves time, that's why we go for them. So actually, I think eating healthy is actually not expensive. Yeah, we only feel it's expensive, but it's not expensive. It might be time consuming, but trust me, it's worth your time. Yes, that's just it. So fruit, vegetables, they are foods that, yes, so they are kind of affordable. Yes. some fruits might be very, very expensive, but there are quite a lot of fruit that are beneficiary to us. Yeah. So if you don't get to eat a particular fruit every day, at least make sure you eat once in a week. And then you have your regular everyday fruit. And then you have your once in a week fruit. You understand what I'm saying? So if
Yes.
to you, you think apple and banana is kind of affordable for you, then you can make it part of your everyday fruit diet. You understand? Like, okay, this is part of my meal. I'm going to eat one banana, one apple, or a slice of banana, or I mean, a slice of apple, or this one and that one. You understand? If pineapple
Yes.
is very expensive, okay, I'm going to eat pineapple once in a week, not every day. So the whole idea is we have to balance it. Yes.
Yeah. Yeah.
So
Wow.
balance, low fat, high fiber diet. So those are the things we should actually like, look into.
Thank you so much for that. So I want to go a little bit personal now. As a Nigerian studying and living in Germany, did the change of climate or the change of environment have any effect or have, any effect on your physical or mental health?
Wow. Yes, yes. Well,
Wow.
definitely, yes. Because coming from African, I mean, it's a little bit different when we talk about our weather. I mean, our weather or climate system is quite different from what we have in Germany or anywhere in Europe or something. So it's really, really, of course, there is quite a lot of challenges. At least I remember when I first came to Germany, I mean, the first winter that I had was quite very funny because I was just like, what kind of cold is this? I mean, there's nothing that I'm going to put on. I'm still going to be feeling cold because my body has not good. And I think I came maybe few weeks to when winter was starting properly. So you could really see like there's like I have to. It's not easy to get adapt. The same thing happens to lifestyle and behavior and choices that we make. Yes, it's not easy to actually change or to get or to adapt to a new environment and everything. So I was, it's really affected me when I came. I was always very, very cold. I mean, every time my nose was running, every time this one, it got to a point I was like, okay, I'm gonna go see a GP. And when I went to the hospital, they were just like, you just have to go and keep yourself warm, take coffee or tea, something very warm. I was like, really? I'm cold. Like I'm really, really super cold. Like I don't know what is happening. So you could imagine, but as time goes on, I started adapting, and then my body system started adapting to it. But as at then, I was like, I remember there was even some days I would be like, I'm not going to school today because I can't just walk because my legs are frozen. So I was just like, who even sent me to come? Like it started like, is this not coming to come and put myself into trouble like this? How am I going to survive this? How? And every time some people will still say, oh, we've not actually entered the winter properly. By the time we get to December, it's going to be cold. I mean, really, really cold. And I'm like, are you serious? So what am I feeling now? So so there was this anxiety that started setting in. There was this fear of, I just hope I'm not going to fall sick. I just hope I'm not going to fall sick. Oh, this is really, really bad. You understand? But so it was like that at the beginning. So of course, I haven't traveled to any other European country or US or UK or something. So I've been in Africa my entire life. So coming to the side, it's quite a lot to take in. So I need to overcome the anxiety. I need to prepare myself for it. Like, okay, you can survive this. You see? Can you see people going out on the streets? Can you see? And sometimes I'll be like, are these not people? They are not even like wearing quite a lot of clothes like me. Like I'm wearing like 3 or 4 all together. See people moving. Nothing is wrong with them. So what is wrong? So I started like, okay, let's also see how my body will adjust. And trust me, I mean, like if you ask me how I felt last winter or to now, I can tell you sometimes I'll be like, wow, it's not even cold again. Like my body has started adjusting to it.
Justin, yeah.
So that's just it. But of course, change of environment has quite a lot to do. Yes, physically, mentally, yeah, everything. So I need to start learning quite a lot of things. I need to start learning how to be physically active, So I need to start learning how to. When I started getting to know the benefit of it, most times I remember when I came, I'll be like, oh, this staircase is just too long. I'm just going to take the elevator or the lift. But as time goes on, I kind of started learning that, okay, even taking the stairs actually has quite a lot. You are actually being active, which is really, really good. So I was like, oh, this is interesting. I should start taking the stairs even maybe most of the time, maybe once in a while, maybe when I'm tired, maybe when I'm in a hurry or something, I could take the escalator or elevator or something. But if I have the opportunity to take the stairs, I should take the stairs because it's actually helping me. So you see, but so as time goes on, I started adjusting, to the new environment, to the new lifestyle, to the new behavior. I had a lifestyle that I was living before coming. Okay, I had a lifestyle that was part of me before I was coming to Germany. But now that I'm here, okay, I started looking at, okay, how are they living? How are they doing their things? Why are they doing it? Why is it important for me to do it this way? And the moment I know that, yes, it's beneficiary for my health, then I started incorporating all this healthy living and healthy lifestyles into my normal day-to-day routine. Yeah.
So what are the differences as in between the healthy lifestyle over there over in Africa and the healthy lifestyle here in Europe? Are there like major differences?
Yeah. Like there are differences. One of them was the medical checkup that I said earlier. I mean, we have this nonchalant attitude. I mean, not like nonchalant, but we usually feel I'm not sick, so why should I go to the hospital for what? I don't have that time. I can do that, and then so we don't do. We really do, like. I mean, some people do, but most, like, I know most of my friends, we are not that kind of person that actually goes to the healthcare centers and be like, okay, I want to get my eye tested, I want to wash my teeth. It's not, it's a luxury for all. It's not something that is part of like elderly for us. But when I got to Germany, it was more like, oh, this is interesting, I really like to do this. You understand what I'm saying? So
yes,
they are part of those things. And there's also one thing, I mean, in Africa, I could stay for a whole year working, even though I'm entitled to vacation. I probably wouldn't want to take the vacation because I just felt it's a waste of time. I'd rather just work and then, I just get my money, or just work and then just not going for vacation. But yeah, I started getting to know that, okay, vacation, even if you don't want to take the vacation from your place of work, they are going to tell you it is compulsory for you to take vacation. And I was like, okay, why? But I started getting to learn that, yes, because you can't just be working and working. You need the time to rest as well. So you need time to, there are times that, yes, we are really overwhelmed with what is going on around us, what we are working on, the tasks we have in front of us, the different things that we need to get done. We are really overwhelmed by all this, and we just need a break, just a break. So
yes,
it could be anything. We could travel. We could go for, mountain climbing. We could go anywhere just to go and relax. I mean, just go and relax and then release all the stressful hormonal imbalance that is already in your body system. And when you come back from that vacation or the little day off that you have, you feel refreshed. So I discovered that. So I remember when I went for my first vacation, and I was like, I came back, even though I was like, what am I going to be doing, really? Just sit down and just be sleeping in my house, or what? But at the end of the day, when I go back to work, I really felt quite relieved. A task I've been working on that I couldn't even get to the bottom of it. I mean, within 2 days, I started seeing different ideas started like coming up, different things, like different ideas, like, okay, oh, I should have done it like this, oh, we could do it like this. This makes sense. So I was like, oh, this is really good. So it's those are part of the things that, yes, was actually different for me. So I don't know
Yeah.
for any other person, but for me, I know it's always a busy lifestyle for me when I was in Africa. Like busy Monday to Sunday, I am busy. Like I really don't even have time to sleep. Yes, that's just me. Monday to Friday, I'm working. Saturday, I am doing my own personal business. Sunday, I am doing personal business, and then like that. And there's no really and it's a circle. It continues like that. Like that's how I was living my life for months, for years. So you could understand. So there was no really like a time off or a vacation or just relax. So
Yeah.
it was. So it's one of those things that was actually different for me, and the same also go for like the medical checkup and everything, and also the physical activities. Yes, yes,
Yeah.
yes.
So, as a master student in public health, what's the future now? What's the way forward for you now? Or what are your plans after completing your master program?
Well, after completing my master program, of course, I am looking forward getting an opportunity in an international organization where I can actually, practice what I've actually been learning so far, and also to actually have this work in the field setting. I'm the kind of person that likes to I'm not the person that likes to sit in the office that much. I like to be on the field when things are happening. So I'm actually looking forward to that. That's one. And also two, I'm also looking forward to also going for PhD. Yes. And I'm really looking forward to that as well. So for now, these are like my major plans. So I just want to work in a public health environment. I mean, just to practice all that I've been accumulating, that I've been learning, and how I can also contribute my quota to the community, the population entirely. Yes, because we need. I mean, we need to let the whole world and population knows that yes, your health is now in your hand, and there's a lot you can do to actually stay healthy and also enjoy like the rest of your life without having to spend so much on illness or not communicable disease if you actually start practicing an healthy lifestyle at the beginning.
Yeah.
Yes.
Yes. So we have to make sure that we make the right choices and
We
ensure that
have to make the right choices. Everything matters. Yes. Our mobility, it matters a lot. I know, like, from where I was coming from, we do quite a lot of our transportation is mainly by cars and everything. But coming to Germany, I was like, when I came, I was like, why do they like bicycles so much in this country? So, but as time goes on, I started learning. Like I said, I learned quite a lot of things from German lifestyle, and I started seeing how it has been beneficial to them. So, and I started incorporating it into my whole lifestyle. To that, okay, it's not that I don't have. It's not like, I mean, most of them, it's not like they don't have money or the finance to actually buy a car or to own a car. Some of them even have a car, but they still prefer to, to go to their place of work through cycling or even public transport. So at least they can actually, be physically active, take a walk around, which is really good. So all these are things that, yes, in the African settings, we are still learning about all those things. We are still way behind. So it's a great opportunity to actually, introduce African African population to know that, okay, there are a lot we can do more, even though we don't have the healthcare system in place for us, even though there is no primary healthcare system in your community or village. There's quite a lot that you can do to actually reduce the global burden of disease and to actually prolong your life and have a better quality of life.
Oh, that's amazing. That's good. I'm looking forward to you, improving the health sector, for example, in Nigeria or in Africa as a whole.
Yes, yes, definitely.
Maybe through WHO or one international organization.
Yes.
That would be amazing. That would be really amazing.
Yes.
So where can we find and stay connected with you so that by the time you're working at WHO now, we just say, I know Opeyemi Ayanwale.
Yeah, that would be really, really nice. So you can actually connect with me on my LinkedIn. My name is Opeyemi Ayanwale. So you can find me on my LinkedIn. Yes, that's kind of the most appropriate place that you could find anything that has to do with my personal development, career-wise. Yes.
That's amazing. Thank you so much for everything I've been able to learn from you today. Everything I've been able to learn about, living a healthy life, living a good life that leads to a better physical and mental health. I really appreciate it. Thank you so much.
You are very much welcome. I'm glad to be part of the podcast.
Thank you so much for listening to this podcast. I am eternally grateful for your time, your love, and contributions. You mean a lot to me. Thank you once again for listening and sharing with your loved ones. Don't forget to subscribe and follow this journey on Spotify, Apple Podcasts, and other platforms in the description. Stay blessed.